Psychology of Injury by Brianna Bautista. Psychology of injury includes mechanisms, injuries, causes, reactions, and rehabilitation. Is injury. The term means trauma to the body that results in at least temporary but sometimes permanent physical disability and inhibition of motor function. Injury is perceived to be multi-faced and is used as participating while facing pain, so that the pain or injury needs mental attention during participation. The pain or injury involves some sort of loss of or change in function that directly affects performance capabilities. The injured person must decide whether to initiate and continue participating while experiencing the pain or injury. Although injuries can be physical in nature, the factors influence not only why performers get injured, but also how well and how quickly they can recover. Whether it is physical, social, psychological, and personality factors, as well as stress, contribute to injury. There's a line where injury is separated from discomfort, a feeling that is associated with injury, but discomfort alone does not necessarily result in impaired movement. For instance, one may have discomfort after a heavy workout with being sore but can continue to participate in the activity. To note, it is not necessarily true that pain or discomfort immediately accompany injury. To get a closer look at this image, we can distinguish between discomfort and pain. Now, taking a look at the mechanisms that cause injuries, there are five: physical, social, psychological, personality factors, and stress. The causes. Physical factors, we can see that muscle imbalances, high speed collisions, overtraining, and physical fatigue cause these factors. Social factors can be known as playing with pain and injury. Psychological factors are labeled as stress or pressure, anxiety, burnout, and personality factors, optimism, self-esteem, hardiness, trait anxiety, as well as stress levels, which can have a relationship between life stress and injury. Physical factors are the primary causes of exercise and sport injuries. Sport medicine providers emphasize the importance of physical preparation and fitness in preventing injuries, as well as reducing environmental risks. For example, limiting training on hot and humid days, not pairing individuals of unequal sizes to participate in one-on-one drills in contact sports. Social factors. Playing with injury is seen as a desired characteristic by others, such as friends, family, parents, teammates, and coaches. Individuals appear to endure pain and injury to reach their goals. In the past, it has been a masculine phenomenon because sport and exercise participation was traditionally seen as a masculine activity. So, psychological factors explain up to 18% of the time lost due to injury. Fitness professionals should understand both psychological reactions to injuries and ways in which mental strategies can facilitate recovery. The relationship between athletic injuries and psychological factors centers on stress. A potential stressful athlete situation can be poor performance and or competition, which can contribute to injury, depending on the athlete and how threatening they perceive the situation to be. A situation perceived as threatening increases state anxiety, which causes a variety of changes in focus or attention and muscle tension. This in turn leads can increase change of injury. Investigators wanted to understand whether athletes with low self-concepts have higher injury rates than their high self-concepts, but they have not been successful to identify and measure yet. As mentioned previously, personality factors such as optimism, self-esteem, hardiness, and trait anxiety do play a role in athletic injuries. However, this role is more complex than first thought because personality factors tend to moderate the stress-injury relationship. For example, if a person is characterized by high trait anxiety, the life stress and injury relationship may be stronger than a person who has low trait anxiety. Stress levels. Stress levels have been consistently identified as important forerunners of athletic injuries. Measures of stresses focus on major life changes, such as losing a loved one, moving to a different town, getting married, etc. 85% of studies verified that higher levels of life stress have more injuries. There have been positive stressors just like negative stressors in life. Regardless of whether stress is associated with negative or positive events in athletics' lives, fitness and sport professionals should ask about major changes and stressors in their life and which and with and and when such changes occur, carefully monitor and adjust training regimens as well as provide psychological support. Psychological reactions. There are 5 stages of grief: denial, anger, bargaining, depression, acceptance, and reorganization that they may or may not experience. Sports psychologists recommend that we view typical responses to injury in a more flexible and general way. People do not move nearly through each set stage in a predetermined order. Many have more than one emotion and thoughts simultaneously or revert back to stages that they have already experienced. Individuals who are injured are expected to exhibit 3 general categories. Injury relevant information processing, which an injured athlete focuses on information related to the pain of injury, awareness of the extent of injury, and questions about how the injury happened. Emotional upheaval and reactive behavior. Once the athlete realizes that they are injured, they may become emotionally aggravated and or agitated, as well as feeling isolated and disconnected, feeling in shock, disbelief, denial, and or self-pity. Positive outlook and coping, where the athlete accepts the injury and deals with it, and initiates positive coping efforts, exhibits a good attitude and is optimistic, and is relieved to sense progress. Other psychological reactions. We have to keep in mind that most athletes move through these general patterns in reaction to injury, but the speed and ease with which they progress vary widely. One person may move through the progress in a day or two, others may take weeks or even months to do so. Some other reactions are identity loss, fear and anxiety, lack of confidence, performance decrements, group progresses. There also are signs of poor adjustment to injury. Most people work through their responses to injury, showing some negative emotions but not great difficulty in coping. Some warning signs of poor adjustment of athlete injury to look out for are feeling of anger and confusion, obsession with the question when they can return to play, denial, coming back too soon, and re-injuring, as well as rapid mood swings and many others. How to handle the rehabilitation. By identifying athletes who are at high risk of injury, building rapport with the injured individual, educating the athlete about the nature of the injury and the injury recovery process that it takes to go back to play, teaching specific psychological coping skills like goal setting, relaxation techniques, and imagery, preparing the person to cope with setbacks in rehabilitation, and fostering social support, including emotional support from friends and loved ones. That includes the end of the presentation. Thank you.